Good day, folks. Thank you for joining us here at Your Health. On today's program, we'd like to talk about bilberry. Bilberry is the cousin to blueberry. We know more about blueberry, but bilberry has been used for centuries to promote good vision and good circulation. Plus, it's just packed full of antioxidants and other great nutrients to help improve your health. That's our subject for today, bilberry. Stay tuned for that. But first, let's go to our news. Let's see what's happening in the health world. When children are given antibiotics before age 2, it increases their risk of developing childhood obesity. Researchers from the University of Colorado conducted a large population representative cohort study in the United Kingdom to find exposure to antibiotics before 2 years of age increases the risk of obesity by 25%. They also found the risk of obesity increased with each additional exposure to antibiotics. Each year, 50 million prescriptions for antibiotics are issued to American children, 10 million of which are issued for conditions that do not respond to antibiotics. The study was published by the journal Gastroenterology. Folks, the notion that antibiotics promote obesity has been a hotly contested idea for many years now. In fact, the AMA just published a study that found when antibiotics are given early in life, well, they don't cause weight gain by age 7. That was their study, so what should we believe? It has been my experience that antibiotics use promotes weight gain at every stage of life. In fact, America's meat producers give antibiotics to feedlot animals to promote weight gain and profits. We have overwhelming evidence that they do, but we can always tilt our data to a favored purpose. Statistics can always be used to promote untruths. The point is really that we should make every effort to only use antibiotics when it is clear they will help. Conditions caused by viruses or by allergies, well, they don't respond to antibiotics, and we should not use them for such. I recommend that when your doctor prescribes an antibiotic, ask him directly, is this necessary for my recovery? If so, take them. If not, don't. A common plastics additive is associated with preterm birth. Researchers from the University of Texas Galveston Department of Obstetrics analyzed the blood of obstetrics patients admitted to the hospital for labor and delivery. They found as the expectant mother's blood level of bisphenol A or BPA increases, so do their risk of developing preterm delivery. The study was published by the Journal of Maternal, Fetal, and Neonatal Medicine. Related research from the Endocrine Society finds a newly introduced BPA alternative called bisphenol S, or BPS, can trigger fat cell formation in test tube studies using human cells just as BPA does. Well, folks, we now have some 100 studies that show a correlation between BPA use and adverse health outcomes, some of which are a true threat to life. We all know of the challenges the little ones face when they are born preterm or premature, as we used to call it. No one in their right mind would do anything to put a baby in this kind of jeopardy. These plastic additives like BPA and BPS disrupt normal hormone function by mimicking a very powerful estrogen in our bodies. They create organ developmental changes in animals. They promote obesity in humans, interfere with normal thyroid function, cause behavioral problems in children, and may even cause cancer. No one wants to take the chance that these studies are wrong, so food and plastic producers have come up with a way to say their products are BPA-free. Just replace the bad molecule with another bad molecule that no one knows about yet. But now you do. Don't fall for it, folks. BPS is just as bad as BPA. Tetanus boosters may not be required. Most American doctors recommend taking a tetanus booster immunization every 10 years after the original tetanus vaccines given during childhood. The new research challenges that notion. Researchers from Oregon Health and Science University evaluated 546 human subjects' antibody levels to the tetanus germ. Having a high antibody level protects from the disease tetanus. They found a single vaccination provided protection from tetanus infection in adults for at least 30 years. The authors of the study report changing tetanus booster shot recommendations to age 30 and 60, as opposed to every 10 years, would save $1 billion in just 4 years. Well, folks, this is an example of doing things because we've always done things that way. I was told as a young doctor in training that we should have tetanus booster shots every 10 years. I've told thousands of people that same advice because I thought it was based on good information. This new study published in Clinical Infectious Disease finds adult tetanus shot protection from tetanus, something no one wants or should have to endure, lasts for at least 30 years. I looked into this matter and found many advanced countries like ours do not recommend tetanus shots every 10 years. Many recommend one booster at midlife. Others do not require any boosters after the initial series is completed during childhood. This is the first American study that I'm aware of that makes this 30-year recommendation, so I'm sure many doctors will continue to recommend a booster every 10 years, but personally, I will not be taking another till I'm 90. Today on Your Health, we'd like to discuss bilberry, the medicinal cousin of the blueberry. Stay tuned to learn more. Can you lower your risk of disease? The answer is yes. One way is by including fruit in your diet. Fruit contains valuable nutrients that can reduce the risk of heart disease, stroke, and even some cancers.
We've searched the world and found 4 fruits we believe are among the best. Noni from Polynesia, acai from the Amazon, and 2 new ones, goji and mangosteen.
These 4 juices each have amazing properties that make them great additions to your nutritional plan. If you're a diabetic or have chronic pain, these juices will help you feel better and have more energy. Plus, they help with digestion.
Now you can experience the health-promoting benefits of all 4 in one convenient package we call the Fruits of the World 4-Pack. And remember, it's 50% off by the case. Give us a call at 888-442-1828 or go online at bioinnovations.net. I'm Cindy Becker, and this is Your Health at a Glance. Do you want to maintain your mental clarity? With people living longer, we need more research into the ways to lower the risk of dementia. Studies are showing us that people who regularly read books, complete puzzles, or solve word games like the Sunday crossword puzzle maintain their mental abilities longer than people who don't. We also preserve memory by maintaining social activities, such as volunteering, attending religious services, or regularly talking with friends and neighbors. And diet plays a big role as well. It's important to eat a nutritious diet free from heavy metals and chemical pollutants and full of vitamins and the essential fatty acids which power the brain. These simple and important steps will help keep you mentally healthy for many years to come. For Your Health at a Glance, I'm Cindy Becker.
There are thousands of fungal species, and at least 200 of them have been found to cause human diseases.
Fungal infections are common, so what can we do to protect ourselves?
One solution is oregano, a natural alternative. Oregano fights problems created by fungus and yeast overgrowth, and it improves many other health conditions.
At BioInnovations, we offer oregano in gel caps and liquid extract.
Yeast and fungal disorders can improve.
So take charge of your health by choosing a natural alternative such as oregano gel caps or oil of oregano liquid extract. Give us a call at 888-442-1828 or go online at bioinnovations.net. Check out our AutoShip program for additional savings. Welcome back, everyone. It is just such a blessing to be with you today, and we will be taking calls, so be sure you pick up the phone, dial our number. We want to talk to you today. But first, we're going to be learning all about this amazing little fruit, the bilberry. You know, we think of bilberry extract as something that we want to take to nutritionally support our eye health, don't we? Well, we're going to learn there's a lot more to this amazing little berry than just eye support. It's great for vascular issues, cardiovascular issues, and much more. So, Richard, let's talk about bilberry.
You know, you're right. Bilberry has been used for many, many years to support eye health. And in fact, in World War II, the Battle of Britain, the Royal Air Force would serve their pilots bilberry pie and jams and whatnot, trying to help their vision so they could fight the air war over the British Isles in World War II. Bilberry it's a really beautiful, deep purple berry. It's native to the British Isles and throughout northern Europe. Bilberry is known as blueberry in other languages. So like, perhaps Sweden, the word for blue would be the blueberry, but it's not blueberry that we think of. They're related, but it's not the same plant. Other words for bilberry: whortleberry, wineberry, myrtle blueberry. It looks like the blueberry very much. It's related, but it is a distinctly different species. And one of the easiest ways to tell them apart is bilberry, the pulp is red to purple, but the blueberry pulp, especially when it's not quite ripe yet, is a yellowish green. So we have a lot of that purple, deep bluish color concentrated in the bilberry, and that's part of its medicinal effect, is those deep purple pigment colors. The scientific name is Vaccinium myrtillus. You'll see that mentioned. A unique thing about this berry is it grows in nutrient-depleted soils in temperate regions in the very far north. In fact, in Sweden, 20% of the wild land is covered in bilberry. Typically, over the generations and years, bilberry has just been wild harvested in these regions, but now that there's a demand for it throughout the world, it's being cultivated. Putative or historical uses of bilberry include an astringent. Think of an astringent as something that if you have a wound that is oozing and swollen, it constricts that wound and helps to dry that wound out. It acts as an astringent, a daily tonic, treatment of intestinal, respiratory, and skin infections. It has been claimed to improve vision in the World War II pilots that we spoke about. It is used to treat wound and gastric ulcer healing. It has anti-inflammatory properties and, of course, a natural antibiotic. That's its putative use, historical use. If we analyze this little berry fruit, we would find it has a very diverse chemical composition. It has fruit acids, quinic acids, citric acid, and malic acid. Now, malic acid we see in Granny Smith apples. In the healing diet, we allow Granny Smith apples as a prominent fruit because they're relatively low in sugar and they contain high amounts of malic acid. Why would we want that? Malic acid kills yeast and abnormal intestinal bacteria. So now, folks, you have another source of a fruit, a berry, that contains higher levels of malic acid, helps to control the yeast. Part of your daily routine. One of our goals in this program is to teach you ways to replace medicines with foods so that we're not so dependent on medications. And bilberry is a good one to help us get malic acid in our diet. And of course, citric acid, when we have that in our diet on a regular basis, it helps to decrease your risk of kidney stones. It binds up the oxalate in the gut, pulls it out through the intestinal tract as opposed through the urinary tract where it can form a stone. Bilberry also contains tannins, catechin tannins, such as the oligomeric procyanidins. Now, these are the same purplish blue color pigments found in grape seed and grape skin. So much of the benefit of the grape is also found in bilberry. So we have an alternate source of these procyanidins. We have flavonoids, including quercetin, astragalin, and hyperoside. The polyphenol antioxidants are quite abundant in bilberry. Iridoids, like aspergilloside, these are defensive molecules that the plant makes to keep bacteria and fungi out of the fruit, to keep it pure and clean. Caffeic acids, chlorogenic acids, these are intermediates in lignin formation that gives the plant its structure. And of course, pectins, a soluble source of fiber. Pectins. We use that to make jams and whatnot, but we can also use it as a fiber supplement and to improve our fiber content of our diet. Bilberry is rich in vitamin C, vitamin A analogs or equivalents, such as beta-carotene, vitamin B1, B2. Here we have a fruit with the B vitamins. This is why vegans should include more berries in their diet, because it's a rich source of B1 and 2. We find those vitamins in meats, eggs, dairy products. But here's a berry with rich source of B1 and B2. Also, bilberry contains vitamin E and vitamin K. It's rich in copper, chromium, manganese, zinc, and it even has a little iron in it. The pharmacological actions determined by science when we study this remarkable berry, We find categorically it improves ophthalmic health, it gives ophthalmic protection and improvement of vision. It helps with wound healing, it promotes wound healing. It has anti-peptic ulcer properties. This can be immensely helpful, and we'll talk a little more about that in just a minute. It is anti-atherogenic, meaning it helps to prevent cholesterol plaques in the arteries. It promotes blood flow, vasoprotective. Remember we talked about grapeseed extract and how it helps circulation. We find the same properties in bilberry. Vasoprotective, inhibition of platelet adhesiveness. Our little platelets in our bloodstream, their intent are like snowflakes, and they plug up any little gaps or damage to the artery or capillary walls. It's the first step as they become attached to that little hole and they plug it up, kind of like radiator stop leak, very similar to the same concept. When they begin to attach to that damage, there's a chemical reaction and it releases activating factors that initiate a blood clot. So it's the first step in controlling blood loss in the event of trauma, and it can be micro traumas. It can even be a sore on the artery wall, no trauma at all, just poor nutrient intake or inflammation in the system. The artery wall becomes inflamed. And these platelets will become so sticky and adhesive we make blood clots needlessly. Well, bilberry is one of your absolute best agents to prevent this adhesive, sticky platelets that get us into so much trouble in the world. What I'm talking about, folks, are people who have a stroke at 39 and we can't figure it out. He had a heart attack at 35, his cholesterol was normal, he didn't smoke, we don't understand why he had this. This is the sticky platelet syndrome. And things such as bilberry can help to prevent this problem. There's such a powerful anti-adhesive sticky platelet concept here. Does that make sense? Because this is really important. Don't forget, folks, cardiovascular disease, vascular occlusion problems, emboli, clots, #1 cause of death in our country. And it all starts, in effect, with these sticky adhesive platelets. And if we can make our blood be less sticky, we're going to have better circulation and better health. And bilberry plays an important role here. Inhibition of platelets, it's a powerful antioxidant. Not only does it act as a chemical antioxidant, but it gets involved in cell signaling, turning on your native antioxidant pathways. We found this with curcumin and grapeseed extract, resveratrol. These powerful antioxidants, these polyphenolics, they affect your cell's physiology. It improves it. So it's a dual-action antioxidant, which is very impressive. It improves the physiology of metabolic syndrome, just like the grapeseed extract does, but it does it also in an alternate source. And it is a natural antibiotic that we can use topically or systemically. Well, let's do this. Our next topic is modern scientific studies, both laboratory studies and in the clinic. So let's get back to that after these important messages. Have you heard of Cordyceps sinensis, the medicinal mushroom that supports metabolic processes for stimulant-free energy? This remarkable mushroom also supports the immune and respiratory systems, as well as the heart and lungs.
BioInnovations brings you Dr. Becker's Bionutrients, Cordyceps sinensis.
Medicinal mushrooms contain beta-glucans, compounds that promote healthy immune function while helping to coordinate multiple body systems. And Cordyceps sinensis is among the safest and most powerful medicinal mushrooms available today, making it your choice for stimulant-free natural energy.
BioInnovations is the affordable source that you can trust for all your vitamin and supplement needs. Give us a call at 888-442-1828. That's 888-442-1828. Or order online at bioinnovations.net. Be sure to ask about the AutoShip program for additional savings. I'm Cindy Becker for Your Health at a Glance. Are you looking for a healthy replacement for sodas? For thousands of years, the Far East has enjoyed the many health benefits of green tea. Now the Western world has embraced this potent antioxidant for its many health benefits as both a drink and supplement. Green tea has been thoroughly researched. It's been shown to improve bone density and immunity, as well as levels of cholesterol, blood sugar, and blood pressure. Research has also shown it to decrease inflammation and one's risk of cardiovascular disease and many forms of cancer. One recent study even found that people who drink 5 or more cups a day were 33% less likely to develop conditions that cause disability. For health, it is everyone's cup of tea. For Your Health at a Glance, I'm Cindy Becker.
Vitamin D deficiency is at epidemic levels in the United States. Chances are you aren't getting enough of this essential nutrient. Vitamin D is one of the most important molecules in the human body. It's required for the proper function of nearly 4,000 genes and 1,000 metabolic chemical reactions.
BioInnovations brings you Dr. Becker's Bionutrients Vitamin D3. Now, supplementing with vitamin D is safe and affordable.
Studies show that vitamin D deficiency can lead to poor immune function, depression, cardiovascular disease, bone disease, diabetes, cancer, and much more. Starting supplementing vitamin D today for better health tomorrow.
BioInnovations is the affordable source that you can trust for all your vitamin and supplement needs. So give us a call at 888-442-1828 or order online at bioinnovations.net. Be sure to ask about the AutoShip program for additional savings.
We're back, everyone, talking about the amazing antioxidant bilberry extract. This is just another way that we can use something from nature to really improve our health. This is just great. Well, let's turn our attention now to the science. You're going to be amazed about all the research studies that there is out there on bilberry. Richard?
Yes, the anti-neoplastic, anti-cancer effects of bilberry. They have determined the mechanisms, at least one or two mechanisms, by which bilberry helps to prevent cancer in people. Get this, test tube studies show that the anti-carcinogenic action of bilberry is via inhibition of induction of ornithine decarboxylase by tumor promoter 4-ball-12 myristate 13 acetate. Can you believe this language? God bless our scientists, because this is difficult material. All that means is they've been able to determine how bilberry helps to prevent cancer. They've done the tests on it. They've got it all figured out. It does it through being a powerful antioxidant by affecting cell signaling. It turns on the cellular mechanisms that help to heal and repair us. And they've done a variety of tests in test tubes that show action against colon cancer, breast cancer, leukemia, and other types of cancer. So that's the bottom line on this. You know, and if we trace this all the way back to well over 100 years ago, doctors and scientists observed, you know, people that eat healthy, they have a longer, more healthy life. Why is that? See, that's the big question. And they've been working diligently ever since to help to describe and understand that phenomena. And this is just a small piece of that. Bilberry is also an antioxidant. Multiple studies show bilberry is a potent antioxidant proven to prevent the oxidation of LDL cholesterol in the artery wall. That's the initiation of the plaque. It helps to prevent that. And it helps to recharge vitamin E. It is an anti-ulcer agent, which is remarkable, folks. You know, aspirin and aspirin-like products, ibuprofen, Celebrex, you name them, they all can irritate the stomach, some more so than others, but they all can do it, and they can all end up in ulcer formation. It's estimated some 30,000 people die from hemorrhage secondary to non-steroidal anti-inflammatory drugs every year. Every year this happens in the United States. From something as innocent as aspirin. Well, bilberry could help to drop those numbers because they've been able to prove that bilberry helps to promote the prostaglandin synthesis in the stomach lining, which protects the stomach from its own acid. Why does the stomach not digest itself? It can digest a steak. Well, it's this prostaglandin mucus lining that protects the stomach, and bilberry promotes that. Pretty amazing, isn't it? So let's make this as practical as possible. Let's say you have arthritis and you take an anti-inflammatory on a regular basis and you're having a tough week and you've had to double up your dosage. If you take bilberry with that, you will have less stomach irritation. Now, I can't guarantee you won't get stomach ulcer and bleed and this type of thing, but the studies show that it helps and it makes a difference. So take it for what it's worth. These are things that can really help you get through the day when you're living in chronic pain. It is a powerful antimicrobial. It's been shown to have activity against Salmonella, H. pylori. Here's another good one. How many people have taken multiple courses of antibiotics only to be reinfected with H. pylori over and over and over? This is a stomach germ, and it can lead to stomach ulcers and gastric ulcers, duodenal ulcers. Very painful, very uncomfortable. And it may, in some people, lead to stomach cancer. This is very common. It's thought that half the people in the world have this. Not everybody gets an ulcer from it, but many do. And so we know that bilberry helps to kill off that H. pylori. So if you're struggling with this, add the bilberry. Mastic gum is also very good for the H. pylori. Probiotics and a healthy diet and vitamin nutrient replacement will help you with the H. pylori. Next, microvascular injury. The anthocyanosides open blood flow via the prostaglandin system. That's the categorical discovery of the bilberry and how it improves circulation. Opens up the blood flow. You know, folks, longevity, good health is all about blood flow. You can reduce it down to that basic element. If the organ does not have proper blood flow, it will suffer, and so will you. You cannot live a long, healthy life with compromised circulation. So anything that opens that blood flow up, nourishes the organs, the eyes, the kidneys, the heart, all of it, that is a good thing. And bilberry does that, and they have good science that shows that. Platelet aggregation inhibition. The anthocyanosides induce an increase of intracellular cyclic AMP, which causes release of prostacyclin 2-like substances, which reduces thromboxane A2. They've worked all this out, how bilberry inhibits that stickiness. You know, an interesting thing as I researched this today, we find that this sticky adhesive platelets, it usually occurs when people are under stress and when their ATP levels drop. You know, our ATP is our cellular energy molecule. And when we use some energy off that ATP, it's reduced to ADP, 2 phosphates. It still has some energy in it, but it's not as powerful as the ATP. So when the ADP rises, you've been working, you're stressed, you've used up your ATP and your adrenaline level is high, this is when the sticky platelets hit you. This is where bilberry prevents that event from happening, which could go on to have a stroke, could go on to heart attack, clots, embolies, vasculitis, all sorts of circulatory problems. And bilberry is one that can just be remarkable with this. Now, I know there's people watching today, they're going, now wait a minute, I've had phlebitis. Boy, I was in the hospital for a week with that. That was terrible. I don't want that again. Or heart attacks run in my family. Or my brother had a heart attack at 38 and we never did figure out why that happened. Well, we're describing those phenomena. And I'm hopeful you're paying attention because this can make a big difference in your life. Next categorical area for bilberry's help is wound healing. Promotes capillary stability and strength. Now, let's go into a couple clinical trials in humans. All of this up to now was the test tube and general science. Platelet inhibition. Here's 30 subjects, 480 milligrams of bilberry extract with vitamin C, 3 grams a day. They were evaluated at 30 and 60 days. Platelet aggregation was clearly reduced in all subjects. The effect of bilberry was greater than vitamin C alone, but when you take bilberry with vitamin C, it is the most powerful. This is very important because this is the core reason for our #1 killer in America today. Diabetic retinopathy, circulation to the diabetic eye. The retina needs that good blood flow. 40 subjects with diabetes all had retinopathy or at high risk for retinopathy. 160 milligrams a day of bilberry extract, 30 days. 80 to 90% of all the subjects showed improvement of diabetic retinopathy from bilberry. Second study, 40 patients with diabetes, placebo-controlled. 50% showed improvement. Third study, 12 subjects with diabetes, 600 milligrams for 60 days. And this one's unique. They radio-labeled the amino acids, a few of the amino acids in the bilberry, and they showed a decrease in collagen formation in the retina, reduced scarring. This is really important. So your lutein helps with the photosensitive molecules in the back of your eye, lutein, zeaxanthin. Bilberry improves the circulation to the eye and reduces the scarring from the high metabolic load of the glucose in the back of the eye. The combination of lutein with bilberry, phenomenal for the diabetic eye. Put these things together, integrate these things, get synergy, get some action here. This stuff really works. Time for one more. 40 diabetics, bilberry paranthocyanins, 160 ml, twice daily. 80% showed improved retinas. We have multiple studies now. And improvement of the diabetic retinopathy, less scarring in the back of the eye, all with bilberry. Who would think a little blueberry that grows out in the wild of the frozen tundra of Sweden would provide such benefit to those of us with diabetes? The gifts God has given us. We have a break. We'll be right back. Every day, about 200 million Americans do not get enough of a key essential mineral.
That mineral is magnesium. The typical American diet does not supply enough.
And magnesium is so important. It protects bones and helps more than 300 different enzymes in the human body perform efficiently.
That's why BioInnovations offers chelated magnesium capsules for oral use and topical magnesium gel to be applied to the skin. That's 2 forms of magnesium to meet your daily needs.
Scientific evidence points to chelation as the best method of vitamin and mineral formulation.
So call 888-442-1828 or go online at bioinnovations.net to place your order. Ask about the AutoShip program for additional savings.
Because chances are you are one of the 200 million Americans who need more magnesium every day. I'm Dr. Richard Becker for Your Health at a Glance. More and more people suffer from asthma. One cause is obvious. The world is a polluted place, and the air we breathe is not always healthy. But other causes of asthma aren't as obvious. Recent research connects a poor quality, high sugar diet and the frequent use of antibiotics to higher rates of asthma and cases of asthma that are tougher to treat. A fast food diet does not meet our nutritional needs. Plus, the indiscriminate use of antibiotics can seriously disturb the delicate balance of healthy microbes in our intestinal tract. So switch to a garden fresh diet that calms and prevents asthma. Eat fruit-like veggies such as tomatoes, cucumbers, and eggplant. Eat yogurt, ginger, turmeric, and take fish oil. Nature holds the answer, but it's up to us to make healthy choices. For Your Health at a Glance, I'm Dr. Richard Becker. Have you heard about the health-promoting power of medicinal mushrooms? These remarkable mushrooms include maitake, shiitake, reishi, and ABM. The medicinal mushrooms contain beta-glucans, compounds that promote healthy immune function while helping to coordinate multiple body systems.
BioInnovations brings you Dr. Becker's BioNutrients Mushroom Complex with maitake, shiitake, reishi, and ABM in one convenient product.
Our mushroom complex features the safest and most powerful medicinal mushrooms available, providing natural support for a variety of health conditions.
BioInnovations is the affordable source that you can trust for all your vitamin and supplement needs. So give us a call at 888-442-1828 or order online at bioinnovations.net. Be sure to ask about the AutoShip program for additional savings.
We're back, everyone, talking about the amazing bilberry extract. And to help you get it, BioNutrients now has Dr. Becker's BioNutrients bilberry extract. This is just fantastic. So to help you, we have that buy one, get one free. And that's today only. Don't want you to miss it. You buy one bottle at the regular price, you get a second bottle free. Well, now let's continue on that amazing research. Richard,
Yes.
I think you have a story about cataracts.
We do. Bilberry is also helpful in slowing down and even reversing cataracts. This is quite remarkable. We talked about diabetic retinopathy, less hemorrhaging, less progression, less scarring. The back of the eye needs to be soft and flexible. And as it scars, it stiffens, and that can lead to fracturing of blood vessels. Then you have more bleeding, which is highly inflammatory, more scarring, and before you know it, you can't see. This is basically how it works. And it's all driven by the diabetic free radical generation of high blood glucose levels. Bilberry helps that, folks. It reduces all of that. It's worth looking at. Next, cataracts. 50 subjects with early cataracts, 180 milligrams of bilberry with 100 milligrams of vitamin E. And you're doing that in your multiple, right? You're getting your vitamin E at that level, at least that. Well, only 1 out of the 50 failed to show improvement in cataracts. Prevented the progression of cataracts in 98% of those subjects. Next study, 51 patients with cataracts. Bilberry with vitamin D over time caused regression of cataracts. Now, if you are blind from cataracts, I don't know how long it would take for bilberry to reverse it so you could see again. But this study suggests it would with time. The best approach is to live healthy, use your bilberry, and prevent the cataracts in the first place. Or stall the progression and maybe you won't have to have the eye surgery. But it does help with cataracts. Next, severe myopia. Very, very advanced near vision. You can't, all you can see is nearsightedness. You can't see far away. These people have a lot of trouble. They have higher rates of cataracts. They have bright lights dazzle them. It's hard to deal with it. And so with severe myopia, 42 subjects with advanced myopia, 150 milligrams for just 15 days resulted in reduced dazzling, improved clarity of vision, and improved twilight vision. Okay. Night vision, bilberry, improves pupillary response time, faster pupil contraction, and quicker acceleration of pupil in response to varying light conditions. We also have learned through studies that bilberry stimulates the production of rhodopsin and the adaptation to changing light environments, which is very important as we age. How many people, when they hit 65, 70, I can't drive at night anymore. I just can't do it. I can't go from the lights of the car coming at me to the darkness ahead of me. I can't do it anymore. Bilberry helps you to adapt to that. And you're beginning to see why the World War II fighter pilots wanted bilberry pie before they flew. It makes a difference. Next, improvement of vision. Multiple studies conducted on normal subjects failed to find bilberry improved already normal vision. But what about failing vision? This is all these studies here. The improvement of vision is for those with faltering vision, whether it's from retinopathy, advanced myopathy, night blindness, etc., etc. This is where bilberry. Is it going to take a healthy 18-year-old with perfect eyes and make him into Superman eyes? No, it's not going to do that. And so you see studies set up to do this. Those are studies to discredit natural methods. That's all they are, because there's nothing on this planet that makes us superhuman. That's an absurd notion, but that's what they expect you to fall for. Yeah, well, don't do that. We're here to help sick people. People who have failing vision and difficulty. Bilberry is part of the answer for that, folks. It certainly is. How about dysmenorrhea? Next one. 30 patients with difficult, painful periods. 320 milligrams of bilberry extract for 3 days prior to menses. Less nausea, less vomiting, soreness, and tenderness. How many young ladies miss school, miss work because of these difficult periods? There's something that can be done. A lot can be done. Bilberry. Add some magnesium to your diet, to your supplement list. Vitamin B6, vitamin D, a little progesterone the 2 weeks before the start of the period. You're going to start getting better. It takes a few cycles, but the dysmenorrhea does not have to be so bad. We can get through this a lot easier. Next, gastric ulcers. We talked about that. Bilberry promotes the prostaglandin synthesis that helps to protect the stomach, and they've done studies that show this, increasing levels, better tolerance of aspirin-like products. And finally, varicose veins. 47 patients with phlebitis secondary to varicose veins. Have you ever had this? Talk about painful. It's as though your thigh or your calf were hit with a baseball bat, but you weren't. It's swollen and painful, and my goodness, you intuitively, instinctively know this is a big problem. You know, it's one of those things that this cannot be good. What do I do about this? Varicose veins, 47 patients with phlebitis secondary to varicose veins, 480 milligrams. It's a higher dose, more need, higher dose. It led to reduced swelling and edema, less heaviness. The leg feels like a lead stump. Less heaviness, less burning pain, less leg cramps, less itch and tingling, less paresthesia, while it helped to preserve skin thickness and color. Bilberry also reduced the occurrence of bruising with friable veins. So many people they bruise so easily as we age. Bilberry helped to reduce that. Isn't this amazing? It's from a little berry. Who would know? You know, if you think about it, as you study God's nature, He put these little jewels right where we'd need them. Imagine the people in the frozen north. They're a calorie-poor land. Living is hard. And so when they find that little berry in the fall, it's a prize. You've got to keep that. It'll get you through the winter. It'll prevent the scurvy. And so, you know, He just gave us these gifts. Isn't that amazing? And we can use them to our advantage. Let's go to our break, and we have who should consider taking bilberry. If these diagnoses are in your history, think about it. We'll be right back.
Are you one of the 62 million Americans suffering from gastrointestinal problems? Do you struggle with other chronic conditions? That's why we offer Dr. Becker's Bionutrient Probiotics.
After years of research, we developed a revolutionary probiotic formula with GastroDefense technology. This system protects the good bacteria from stomach acid so the probiotics reach the intestines where they go to work. Additionally, we use live count technology to prolong the shelf life of the probiotics, so there's no need for refrigeration.
Dr. Becker's Bionutrient Probiotics is a powerful combination and one of the most effective formulas available today. And we offer a children's chewable formula too, both at prices you can afford. Order online at bionovations.net or call 888-442-1828 and ask about the AutoShip program for additional savings. For many of us, the days pass on by. Whether it's living for the weekend, waiting till the kids come home, or waiting for whatever is next, don't waste your life waiting on tomorrow when there is still today. Benjamin Franklin said, "Do you love life? Then do not squander time, for that's the stuff life is made of." The Lord did not give us today to sit and wait on tomorrow. What we do today shapes our tomorrows. As David wrote in Psalm 90:12, "Teach us to number our days, that we may gain a heart of wisdom."
Is your life out of balance? It may be. The average American consumes far too many omega-6s and not enough omega-3s. This creates an imbalance.
So what can we do to get back in balance? We can eat a healthy diet.
And most of us need to supplement with omega-3 rich fish oil. Fish oil contains omega-3s with DHA and EPA, fatty acids that promote good brain and heart health. So reduce omega-6 in your nutritional plan and boost omega-3 to get back in balance.
To help you do that, BioInnovations offers two products, the Fish Oil Complex and Omega 369, both formulated for your health and well-being. So how do you choose? For highest levels of DHA and EPA, choose the Fish Oil Complex. For a balanced formula, choose the 369. Give us a call at 888-442-1828 or go online at bioinnovations.net. Check out the AutoShip program for additional savings. We're back, everyone, talking about the amazing bilberry extract. And to help you, we have Dr. Becker's Bionutrients bilberry extract at BioInnovations. Really great. This one today is buy one, get one free. So you buy one bottle at the regular price. You know how it works. We're going to give you a second bottle free. Great way to put this in your nutritional plan. So, Richard, I know there's been a lot to cover, but this has been great.
Yeah.
And I think it's really amazing to bring all this variety of information to the people so they see it's not just one thing. That's not how nature works.
No.
It isn't just take one prescription. This
No,
is
it's not
nature.
like that.
Things work together.
This is food.
It's great.
It's a symphony of agents.
Right.
And
So yeah, I want to help my eyes, but when I help my eyes, look what else I'm going to do. This is great.
yeah, it is.
That being said, who should consider adding bilberry to their plan?
Bilberry can be used as a daily tonic for anyone who's relatively healthy and they want to stay healthy. You know, a couple doses a week, it's good. Or if you're in trouble with your health, you can take it. Diabetes in general, and if you have diabetic retinopathy, please. Bilberry complements lutein zeaxanthin beautifully. It's a good addition. Do you have cataracts? You want to slow that down, stall it? Get a few more years before you have to have the operation. Any type of cardiovascular disease, coronary artery disease, peripheral vascular disease, vascular insufficiency, phlebitis, varicose veins, even hemorrhoids can benefit from bilberry. And don't forget the sticky platelet syndrome. Bilberry would be a nice complement to your aspirin therapy because that's the standard treatment is aspirin. But bilberry would complement that very nice and help protect your stomach a little too. Next, gastrointestinal conditions, peptic ulcer disease, anti-inflammatory use, non-steroidal use, infections of the intestinal tract, and particularly the H. pylori or gastroenteritis. Any type of inflammatory condition, arthritis, including gout, helpful with gout, inflammation of any source, dermatitis, it can be applied directly. You can make a little paste, to open a capsule and make a little paste and put it on sores and wounds. It helps. It promotes wound healing. Inflammation of the mouth. We didn't get into the science on this, but the inflamed mouth associated with chemotherapy, radiation therapy for cancer, it's helpful for that. In fact, the German E-Commission approves bilberry use for that exact thing, which is nice to know. Wound healing, menstrual issues, we discussed that. Thermal burns. It's up there with aloe vera in its ability to help with a burn on the skin, even sunburn, thermal burns or sunburn, and improved circulation in general. Side effects, we do need to talk about this. Increased bleeding times due to the antiplatelet adhesiveness. But this is a desired effect. We want our blood to flow. You should not take bilberry if you're on any type of blood thinner at all without discussing this thoroughly with your doctor. It can be done, but you have to adjust dosages. Don't take bilberry if you're on warfarin, Coumadin, or any of the newer, like you know, medicines, the pills they have nowadays, they're newer and different ones. Don't take those unless you're willing to adjust dosage and do lab work. I hope I didn't muddle that up too badly, because heparin, any of them. But everybody else, you don't need to worry. You can take them. Any antiplatelet adhesion therapy such as aspirin, it can make it more pregnancy or lactation. It hasn't been studied. That's what the literature says, but I can't imagine a little berry is going to hurt a pregnant mother. I just don't see that. You know, this is food that humans have been eating for eons of time, so I don't see a problem with that, but it hasn't been studied. That's all I'm going to say. Perhaps the last trimester when delivery could occur, the antiplatelet effect, it could lead to more bleeding during delivery. So maybe you stop them the month before delivery. But there's always a chance you could deliver early. See, that's the thing. That's why they say it hasn't been studied. So full disclosure, I want you to know everything I know. That's the point of this. If you're taking multiple medicines, 6, 8, 10 medicines, it'd be a good idea to have your pharmacist review them, say, I want to take that bilberry for my circulation. Is it okay, Mr. Pharmacist? And that's always good. Take advantage of your pharmacist. They know so much. They know more about medicines than doctors do. Doctors are trained to diagnose and treat disease, but the pharmacist knows the details on medicines way out there. They're really good at that stuff. So how much do you take? Bilberry fruit, 320 milligram extract, 1 or 2 of those capsules a day, you're good to go. And as a general tonic several times a week, you know, it'd be perfect. So that's your bilberry. There it is. We'll return after these important messages for a call. We'll be right back.
You've heard the news that the nutrients CoQ10, L-carnitine, D-ribose, and magnesium promote cardiovascular health. And now you're looking for quality supplements you can trust.
Dr. Becker's BioNutrients provides you the highest quality Heart-Smart supplements. Dr. Becker's BioNutrients CoQ10 and L-carnitine feature BioSolve technology, which promotes maximum absorption of these critical cardiovascular nutrients.
That's right. Feel the BioNutrients Heart Smart difference when you start your journey to better heart health today with Dr. Becker's BioNutrients CoQ10, L-carnitine, D-ribose, and magnesium.
Just ask for Dr. Becker's Heart Smart plan at BioInnovations, and we'll help you get started today.
Order online or call 888-442-1828 and let BioInnovations assist you in making the right choices to better health. Ask about the AutoShip program for additional savings.
I'm Cindy Becker for Your Health at a Glance. How often do you go into the grocery store to buy just a bag of chips or candy bar? I suspect not very often. Then how is it that these foods make it into our grocery bags and pantries? Do you make impulse choices and buy junk food? To control that impulse, plan your next trip to the store. Write down at least 3 days of menus and build a grocery list with the ingredients needed to prepare the meals. Eat a healthy snack before going to the store. If you are hungry, you're less likely to stick to the grocery list. Shop the perimeter of the store, starting with fruits and vegetables. Have you ever noticed the most healthy foods are in the outer aisles? And avoid items displayed at the checkout counter, trying to entice you to make a last-minute purchase. Follow these tips and make a plan so your next trip gives you control and you come home with bags full of healthy food. For Your Health at a Glance, I'm Cindy Becker.
Do you believe that nature holds the answer to your health needs? Are you looking for a supplement that's simple and pure, yet really works?
If you're looking for nature's answer to better health, look to Aloha Noni Juice. It's pure and fresh, just like nature intended. Aloha Noni Juice is brought to you direct from the islands of Polynesia.
Aloha Noni Juice is 100% pure with no added sugar or sweet fruit fillers. It's the perfect addition to your low-sugar diet.
Aloha Noni Juice drinkers will tell you their vitality, energy, and sense of well-being have improved, along with relief from many painful conditions. Made by nature, proven by science, Aloha Noni Juice contains only nature's best.
And now you can enjoy the benefits of our new 100% certified organic Noni Juice.
Order online or call 888-442-1828 and let BioInnovations assist you in making the right choices to better health. Ask about the AutoShip program for additional savings. Your Health is brought to you by BioInnovations, trusted products for your health and well-being.
We're back, everyone. Just a very quick reminder, we have the bilberry extract, buy one, get one free today. Don't want you to miss it. Buy one bottle at the regular price and you'll get a second bottle free. Well, let's go to the phones and see if we can help someone out there. Let's go to Florida and welcome Diana. Hi, Diana.
Hi, Cindy.
Hello, Diana. How are you today?
Hi, Dr. Becker. Thanks for taking my call.
Oh, it's our pleasure. How can we help?
Well, I'm a 63-year-old woman. I'm overweight, and I'm tired, and I have joint pain. I've had several bouts with, I had a cancer removed from above my eye, and they had some spots, there's some spots on my lungs. And I had a CT scan, and they were checking on those, because I've had those spots for several years, and they just keep checking on them. And they found also that I have a calcification in my aortic valve.
Okay.
And
Diana, are you having symptoms from this calcification of the aortic valve?
You know,
are you ever
I'm
short
tired.
of breath? You're tired?
Not really short of breath, but I'm tired, yes.
Okay.
So I don't know.
Are you diabetic?
No.
How's your vision?
I have macular degeneration, and my vision is, you know.
How do you know you're not diabetic? How do you know you're not?
Well, I've been checked, and they said I'm not diabetic. So
Diana, have you had a glucose tolerance test?
You know what? I don't know for sure.
Have they done the long-term blood glucose, the hemoglobin A1C? Do you remember if they've done that?
No, I don't believe so.
Well, my point of this is you can do spot blood glucose levels, even fasting blood glucose levels. It's not the standard of diagnosis, of diagnosing diabetes. The standard is a glucose tolerance test. You go in fasting, no food for 12 hours or so, and you have a real syrupy drink. It's like drinking a double thick soda pop. And then they check your blood glucose every hour for up to 6 hours. And if it is high after 2 hours, above 180 after 2 hours, you're diabetic, regardless of what your spot fasting or postprandial spot glucose is. So sometimes when the history suggests diabetes, but the morning glucose is normal, that's not enough. You got to do the full formal diagnostic protocol. And it's imperative, because the answer to diabetes is not ignorance, it's knowing. It's knowing you have it so you can treat it. See, it feels good to be told I don't have it, but not if it's not true. You follow me?
Exactly.
So you have the macular degeneration, you have the aortic valve, which, you know, diabetes doubles to quadruples your cardiovascular disease risk. You have all these things, you know, kidney stone and whatnot, and increased cholesterol. How's your blood pressure doing?
My blood pressure is good.
That's good to hear.
It's always been good. So.
What's the one thing that's bothering you more than anything?
Well, I'm tired and overweight, which I don't know if
How much? How much? Can you tell me? I know it's very personal, but it's relevant. How are we doing with our weight? Can you tell me?
Yes, I'm 225.
Okay.
And last year I lost 40 pounds.
Good for you.
But I gained half of it back.
How did you lose it, Diana? How did you lose it? What'd you do?
I went on a restrictive diet called, it's Bob Harper's book, Jump Start to Skinny. And it's a 3-week plan. And I stayed on it a little longer. I lost 20 pounds in 3 weeks, but then I stayed on it another week and lost 20 more. Or
that is,
a couple weeks.
Whoa, you lost 20 pounds in a week?
Yes, sir. Or thereabouts.
That's not normal. Yeah. Have you been to an internist, a endocrinologist who specializes in diabetes, or a cardiologist? Have you been evaluated by a diagnostician?
No.
Yeah, you need this. I'm hesitant to give you any advice other than let's find out exactly what's going on in your body. I think you need the formal diagnostic protocol to establish once and for all whether you're diabetic, because, you know, there's only a couple ways to lose that much weight that fast, and it's rarely fat. You know, you can't burn. There's 3,500 calories per pound of fat.
Yeah.
You know, you're not burning that many calories in the day unless you're running marathons. You can lose fluid. You can have liposuction and draw it out, but the fluid, you're losing fluid. That's a fluid loss. I'm concerned. I think you should see a diagnostician. Would you do that for me?
Yes, I will, Doctor.
I do want to get this point across. Folks, when we're overweight and we're miserable and tired, losing just 5 to 7% of your body weight reverses your metabolic aberration of obesity. It completely reverses metabolic syndrome. Just 5 to 7% of that body weight. You don't have to lose all the weight to start. But getting the body into a weight loss mode, it corrects metabolism. Then you can do things like bilberry and grapeseed extract and vitamin D and the antioxidants, all these things we talk, probiotics, all these things, and you're going to start correcting this metabolism. And you're going to start feeling better. The energy goes through the roof and life returns. But we've got to start with the proper diagnosis. Get into a good doctor and let's find out what's going on. And call me back. I'd love to help you. I want to help you. I'm here to help you. But we have to know the right diagnosis. Just good advice, huh, Cindy?
That's right.
Well, folks, thank you for your kind attention. It was Bilberry Day today. Neat stuff, isn't it? We'll see you next time. Bye-bye.
Thanks, everyone. Bye-bye.
Attention! Anyone owing the IRS over $10,000 needs to listen to this important message. The IRS has created a special program that can potentially save you thousands of dollars by qualifying. Since qualifying for the IRS Fresh Start program is not automatic, we will connect you with a tax professional for a free consultation. Once you're accepted by the IRS, they must stop all bank and wage levies. Call Tax Group 123 now at 800-395-3725 to find out if you may qualify for the IRS's Fresh Start program.
Has your AC busted, computer crashed, appliance broken? Then you need ARW, American Residential Warranty.
Hi, it's me, Anthony Sullivan. And yes, you've actually caught me at home relaxing, because life's been pretty worry-free since I got coverage with American Residential Warranty.
Home appliance repairs and replacement can cause stress and cost you over $3,000 per year.
But ARW has home warranty plans starting at less than $1 a day.
My air conditioning broke on a Sunday. It was so hot. I called ARW and they came out and fixed it right away.
You won't believe what ARW covers. Heating and air conditioning, washers and dryers, kitchen appliances, plumbing, water heaters, electrical systems, flat screens and laptops, even